I'm Dr. Kipp from Department of Orthopedic Surgery at Aarhus University Hospital in Denmark. I'm the first author of this study published in JBJS entitled "The Latarjet procedure may induce pathomechanics with posterior humeral head subluxation, an experimental dynamic radiostereometric study." In this experimental study, we looked at how the Latarjet procedure affects the shoulder joint kinematics during a dynamic external rotation. We used radiostereometric analysis to measure the humeral head translations both with and without anterior directed load. What surprised us the most was that the Latarjet procedure may actually overcorrect the humeral head position. When no anterior directed load was applied, that is, under resting or unloaded conditions, the humeral head shifted posteriorly and inferiorly compared to the native joint. This means that while the Latarjet procedure effectively restores the stability when anterior load is present, it may induce posterior subluxation when the shoulder is not subjected to anterior directed forces. These altered mechanics could help explain the posterior wear patterns and osteoarthritis sometimes seen in the years after surgery. Our findings do not call for an immediate change in clinical practice, but they do show that the stability is dynamic, changing throughout motion and applied loads, and should be evaluated as such. Previous studies focused on static positions or maximal anterior directed forces, which don't reflect the daily use. By studying the shoulder dynamically with and without load, we captured a fuller picture, and it was under these conditions that we found our surprising results. The next important question is whether these posterior subluxations occur in patients in vivo and whether they have a clinical relevance. This work could help refine the surgical technique and increase the awareness of possible side effects following the Latarjet procedure. The Latarjet procedure remains an excellent procedure, but as with most surgeries, one size doesn't fit all. Thank you for watching.